afternoon, or good morning. It's actually so I'm the Judge Oldham. I'd like to thank all of you for coming this morning to our first senior seminar. We thought we'd try this idea and offer a variety of information that seniors are interested in. You'll have a chance to speak with each of our presenters at their table later, and maybe some of them will take questions too during their presentation. Our world is moving pretty fast, and those of us who are a little bit older know that it's getting more and more difficult to keep up with what's going on in the world. You may have mastered Facebook, or know something about it, but there's other things that are out there going on these websites you hear about, and television, the radio, and I don't know, understand what people are talking about, and so it's a fast-moving world, and unfortunately, there are also people out there that want to take advantage of us. I saw in the paper this morning, actually it was on the internet, saw a story about a Mexican cartel that was operating a telephone scam, trickery, calling people in the United States about mortgages, I believe, and apparently 8 people in that organization tried to quit, and the cartel killed them. Can you imagine the viciousness and the avariciousness of people who are after money, peddling, trying to sell things to seniors, peddling drugs to kids? We have some really vicious people in the world that I don't know what God's going to do with them, but we have to protect ourselves against them. So thank you very much for coming today. Later, about 11:30 or so, we're going to offer lunches. We have some good box lunches for everyone and drinks. So, and in the meantime, please, there's coffee there, there's cookies, so you can get up and help yourself at any time. So, our first presenter this morning is from the Attorney General's Office of Senior Protection. I'd like to welcome LaDonna Cable.
Thanks for having me. So good morning. Thanks for coming out. Got a good crowd here. We have some great tables set up around the room. You're going to hear from a number of people. But whenever we have lunch or a break or something, make sure you stop and see people. We've got the Sheriff's Department, the Attorney General's Office. Another gentleman is here with me today, Mark Hord. He's also in the Attorney General's Office, and he's a retired fraud detective with Louisville Police. And so one of the things he helps our office with when we get calls in, if you've been scammed, what to do next, how you can help. Sometimes we can't help. Sometimes the money's gone. When the money's gone, the money's gone. And we're going to talk a little bit about that, but sometimes we can. And so anyway, Mark's here. If you have anything you want to stop and talk to us or get some more information, we have a few handouts. Elder law, Kentucky elder law, senior Medicare patrol. So there's a lot of people, senior home transitions. Check everybody out. So let's see, do I have here we go.
I don't think that mouse connects to that computer.
Okay, so just the next button? Okay. So I'm LaDonna Coble with the Attorney General's Office. Now let me tell you about the Office of Senior Protection. So what do we do? It's not exactly what people think we do. A lot of times people think of Adult Protective Services, which is a different agency. What we do is we help people with fraud, scams, identity theft, and we also have a section of our office that does assist people with business complaints. So you buy a stove from Sears, and the stove doesn't work, then we're able to kind of help write a letter on your behalf and see if there's something we can do to help. So that's a little bit about what our office does. What I want to point out, and I'll mention this again, if you encounter a a scam, you can report it to our office. There's a couple ways. You can call, and you'll see in the bags you got when you came in, there's a brochure, a scam brochure. So there's information, our phone numbers are on the front. There's a 502 number, but there's also an 800 number. Or you can report online. We'll talk about that some more. So why are we here today? You guys know scams. It's gone through the roof. Scams were big before COVID. Scams are enormous after COVID. So according to the FBI's numbers, last year alone, 10.3 billion was lost to scammers. Sometimes it's the cartel, sometimes it's organizations in other countries, sometimes it's people in this country. A lot of the call scams, a lot of those do originate out of the country, but not all of them. It's a huge problem. Part of the problem is it's hard to find these people. It's hard to find where they're coming from because they hide easily behind apps and technology that allow them to spoof or change the phone number so it looks like the law enforcement sheriff's officer is calling, or your utility company, or Social Security, when it's not. It's the scammer who has changed the phone number. So you can't rely on caller ID anymore. Because everybody used to, that's who you know is calling. My advice, if you don't know the person who's calling, don't answer it, let it go to voicemail or something. If it's important, call not the number they leave. Call a verified phone number. Look it up on your own. Find the right phone number. For example, on utility scams, we tell people make sure you call the number that's on your bill or a number you know of, because they'll say they're going to threaten to turn your utilities off. Call us back, and they'll leave an 800 number. And in Louisville, at least, I know the LG&E phone tree was mimicked identically. So they recorded. So if you'd ever called before, you'd be like, well, I called the right number. I heard the answering machine. You can't tell them apart anymore. The number one thing, if you remember nothing else from today, is to never feel embarrassed or afraid that you have fallen for a scam. They're good. They're professional. Again, billions of dollars. These are full-time jobs. This is what these people do. I'll point this out because I don't know if you saw this, but I think this was last summer. Lexington lost $4 million in a scam. It was an email scam. So the email came in and they were getting ready to transfer $4 million to one of the housing authorities, one of the agencies, or community action, I can't remember. And they were expecting the email. So they responded and they transferred the funds to the bank account that was in the email. It looked identical to what the email would look like, but it was a different bank account. So it was the scammers. Now, our office was not involved in that one. The Secret Service and FBI were. They did find the money. They were actually able to get it, and they arrested 2 people in Texas. And it was a 26-year-old girl and a guy that was in his 30s, I think. And they met in a strip club, and he said, hey, do you want to make a lot of money? I've got an idea. Now, of course, they got caught. But sometimes these are pretty sophisticated, and they come from out of the country. Let me give you an example. Day before yesterday, city of Owensboro, it's like the 3rd largest city, I think, their Office of Economic Development. They were scammed. It actually happened in December. The story just broke day before yesterday. They sent $500,000 to a scammer. They didn't mean to. It was another email compromise. They got an email, it looked legitimate. They were transferring funds. They transferred it. They didn't realize it quickly that it had gone to the wrong people. So by the time the Secret Service got involved, based on the articles I've read, the money was already gone. It had gone out of the country. and enough time had lapsed, there was no way to pull those payments back. So, I mentioned that to say it can happen to anybody. But we know that among seniors, only 1 in 44 people will typically report. So why is that? Sometimes people are embarrassed. Sometimes they don't know who to report to. But I encourage you, if anything does happen, feel comfortable to report. Here's how bad COVID has impacted Kentucky's numbers. Now, people will report when they've been scammed to many different places. They might just report to local law enforcement. They might report to the Better Business Bureau. They have a scam tracker. One of the things our office does, as opposed to, and they're great, Better Business Bureau and AARP are great partners. We work together all the time. We do presentations together. One of the differences, if you report it to our office, to the Attorney General's office, is that we're going to get back with you specific to your scam. So if it was an identity theft, we're going to respond and say, here are the next steps you need to take. Yes, maybe you gave your information out by phone. Maybe there was a data breach, whatever you call us about. We're going to tell you, okay, here's what you need to do next. So the next steps part is something our office offers that not everybody can or has the resources. But during COVID, when I came into this role, I'm an attorney by trade, worked in the Justice Cabinet, worked in private practice, came to the Attorney General's office in 2019. The dollar losses were almost 1.7 million. I was like, wow, we need to do something about this. Like, I thought that was a lot. More than doubled. Now, March of 2020, the pandemic hit. More than doubled. By 2021, things are going gangbusters. It's almost 13 million. So I thought, well, this is going to level off, and we're not going to have much of a problem. And instead, in 2022, just those reports that came into our office, it was nearly 32 million. So if you look at the difference between 2019 and 2022, such a short amount of time, it's amazing how sophisticated these scams are and how they're able to get people. So that's why we're here today, and also to recognize that June is World Elder Abuse Awareness Month. So we want to help protect people from financial scams and fraud. I won't bore you with a bunch of statistics, but I do want to point out, among seniors, the average dollar loss per victim, $22,000 is what's been reported to us. So these are just Kentucky's numbers. Here, we have a question.
I don't know how people said this, but is most of this in via cards or cash?
Oh, question is most of this lost via cards or cash? Most is lost definitely in a way that you usually can't get it back. Some is by cards. Some is by cash. Let me tell you the most common things. Gift cards are big for scams. Debit cards, stealing the information. Your debit card, like a skimmer, it can steal your bank account information. That can happen. A lot of people in the larger scams, when you're losing a whole lot of it, $30,000 or something, they might wire the money. And the most common question we get on wiring money is, well, you know the bank account my money went to. So go arrest that person. Like, follow the money. Sounds easy. It's not. So here's what happens. We follow the money, and it'll go through 5 different bank accounts. As soon as it hits that bank, they transfer it to somebody else. And then they transfer it again and again and again, and it'll make 5 hops. And then it'll bounce out of the country. So it's really difficult to ever find. It's not as easy as I sent it to this guy named John Doe. Go get my money back. It's more complicated than that, but it comes in all ways. I'd say probably most common are the gift cards. They want you to pay in gift cards because they know as soon as you scratch off the back and you tell them what the numbers are, or you send a picture of the back of the gift card, it's going to be wiped in 15 minutes. We did have one success story. Because I have to tell people, a lot of times we can't get your money back, the money's gone. But here's one. A lady called our office. She was in a scheme. After she gave them the gift card information, it was like $500. She read the numbers off. She called our office. How long ago did this happen? 5 minutes. It just happened. I just realized this is a scam. Well, it's a long shot. Take that gift card. Get on Amazon or something and spend it quick. Buy whatever. Buy land. I don't know. You can return it. Just go buy something. And you know what? She wiped that gift card before the scammer could. And maybe she returned the item, but you have to be really quick because they know they're gonna transfer it pretty quickly. So what are the top scams that people lost the biggest money in? It's going to be different than what's the most common scam. So we'll get a lot of reports of certain scams, but they don't lose a ton of money. The ones that we saw that lost the most money, number one was investment scams. So they're targeting seniors, and here's why. You guys have a nest egg, usually, or retirement savings, or equity in a home, or something. Some access to money that your typical 30-year-old doesn't have. So they're getting people to, I was going to say that could have been mine. I was like, did I forget to turn my phone? Don't worry about it. They're getting people to, I was probably doing something really weird when she took the picture. This is a scammer. Spam call. They're getting people to roll over their 401ks and investments into, look, get in on the ground floor. Trust me, I've made a lot of money doing this. And maybe you think you're talking to a friend, someone who's really successful in business, and they can help you get your foot wet with Bitcoin. What they do is they take over somebody's social media. So they hack their Facebook or something. Now, you don't know it. Your friend reaches out, you talk to them. They tell you about this. Meanwhile, your friend that you really haven't talked to in a year in person, they're trying to get control of their account, and they're having a hard time getting their account back because once they're hacked, the scammers are changing the password. So you're talking to the scammer, but you think you're talking to your friend, and people are investing. And just with these investment scams, people reported over 14 million lost to our office last year. And when somebody loses their entire retirement account or they mortgage their house, so they'll have money because they're going to double their money. It's pretty devastating for retirees because they're not still working. So it's very difficult to make up that loss. Real estate and rentals, people buying, selling homes that they don't really own, people renting homes that they don't own. That's another common one. That was over 5.2 million. Identity theft is big every year. It's going to be in the top dollar loss and the most common. It's a big issue. The best thing I can do to tell you to protect your identity, protect your social, never give it to anyone who calls you, no matter who they say they are. If they call you, there's no way to know who you're talking to. And to also protect your Medicare number. Very important because there's a lot of medical fraud. So just want to make sure you know about that as well. Romance and social networking. This used to be our number one, number two, but it's still big. Got really big during COVID because people weren't getting out and meeting people. So now you're meeting people online, and that's just the nature of there are benefits to social media. It's great in a lot of ways. I keep up with my own family. I'm like, oh, so-and-so's getting married? What do you mean? The problem is these relationships will go on for months. They'll text you, how's your doctor appointment, how the kids. It's a genuine relationship, a friendship, months. Some of these will go on for years before the emergency drops. Something has happened. They're stranded in another country. They've been arrested. They're in the hospital. There's always some emergency. And they're so distraught and upset and they need you to help. And that's when they ask for money. They might even borrow a small amount of money, $500, and pay you back. So you know they're building the trust. But it's going to happen. That eventually they're going to start asking for big sums of money. I had one guy, not last year, but it was before that, who paid over $800,000. He was in love. And when these relationships end, it's not only are they financially devastating, but people are, they're gutted. I apologize, I can't see a clock. So give me just the wave. Okay, so we're going to roll through these really quick. So those are our biggest sweepstakes and lottery scams. Let me just tell you this. If anybody contacts you and says, you've won a prize, Publishers Clearinghouse, the Jamaican Lottery, there's all kinds of them. Here's the thing. Every legitimate sweepstakes or prize will have a web page. Publishers Clearinghouse included. It is a legitimate agency. Kentucky Powerball, Kentucky Mega Millions, all of those, that says you never have to pay money to receive a prize. The scam is, well, you need to prepay the taxes. And if you prepay the taxes of $30,000, we're going to deliver you a check for $3 million. So, but it's convincing to a lot of people. So I just want to let you know, since we're going to wrap up here, don't get dizzy, I'm going to scroll through some of these. We've talked about a lot of this. Look out for those text message scams. A lot of text messages these days. You can help us stop scams. If you report to our office, again, you can call the 800 number. It's on your brochure. We have additional brochures. And I also want to let you know that one of the things the Attorney General's office does is we do presentations like this. And you're really lucky in this community. You also have a sheriff's department that gets out and does a lot of speaking. I think they're probably going to be up next. But if you have other civic organizations or your church groups, we have longer presentations where we go into the specifics of a lot of different scams. So we just wanted to give you a flavor today of the things to be on the lookout for. So we're here if you need us, and I'll turn it back over. Thank you.
Thank you, Donna. It was interesting to hear about Lexington and Owensboro getting tricked. Someone tried to get us here a few years ago when we built a jail. Our new detention center, a hacker got into the files and got a file, asked for $3 million from the county government to give the file back, which was an important file. We turned it over to our insurance company, CAICO, who handled it from there, and there was a payment made, considerably less than $3 million, but we do all we can. We're constantly alert in the county government. We check, recheck. We have many defense systems set up. It's discouraging to know that there are people who feel their day-to-day job is to try to cheat you. It's just, it's really a sad situation. In fact, a few weeks ago, or back maybe 2 months ago, I got an email from a person that said he was the Henry County judge, and he forgot to buy a gift for his niece for her birthday was that day. Could I go on Amazon and buy a gift for her and he would repay me? Of course, I didn't do it. I sent him back a question. I asked him, I said, who is the person that runs our Tri-County Community Action Agency? Scammer couldn't give me the name, so I knew, I felt right away that was a trick, but anyway, we have some of our public officials here this morning. Kevin Jeffries, magistrate, is here. Wayne Tice is here. Mayor John Black is here. Around the corner is a magistrate, Stephanie Hawkins, who's been out front, so I thank them for coming and sharing their time with us as well. And I noticed that Stephanie's not, but the other three are seniors, so, yeah. Okay, so, my administrative assistant is Tara Long, and Tara has put in a lot of time and effort organizing this event for all of us, so I'm going to ask her to introduce the rest of the speakers today.
Thank you guys all for coming out. We're very glad that you're here. Glad to see a lovely full room. Next up, we're going to have Sheriff Tim Wakefield give us an introduction on what's going on in Oldham County with STEAMs.
First off, I want to say thank you to Judge Vogel for giving us the opportunity to give this presentation. I'm Sheriff Tim Wakefield. I'm going to be very brief and short. I've been saying this a couple of times lately. I inherited what you're getting ready to hear. I don't want to take any credit for it in any way whatsoever other than allowing them to have the time to give you this presentation. This is something that's very important to me because my mother gets these phone calls and these scam attempts all the time, and we've conditioned her, and I'm going to say she's pretty smart. Not smart, but you can't get anything over on her. We tried a lot when we were younger and it didn't work very well. But she'll call me and say, well, guess what? I got another grandchild in prison in Mexico that needs $500. So you might want to make sure all your grandkids are in the right spots before you say no, something like that. But no, thank you all for coming. I don't know if you realize this, but in the United States alone, last year, over $3 billion were scammed from senior citizens. And to me, that's just atrocious that we take the people that put us where we are and scam them out of the money that they've worked hard to put away to live the rest of their lives with. So without any further delay, I'm going to turn you over to Deputy Mike Meese and Deputy Rick Davidson. They do a great job of presenting things to our community. They run our community services division, and I'm just glad that they can give you the information you need to help keep your assets and yourself safe. So I'm going to turn it over to them. Thank you.
Good morning. How's everyone doing today? This is always exciting for us to be at these events because what we're talking about today is so important, and to be honest with you, people just do not realize what an absolute travesty is going on in this country right now being perpetrated by these criminals, and that's exactly what they are. And the sad part of it is this is happening right in our very backyard. At the sheriff's office, we get calls weekly from people that have been victimized, and that's exactly what it is, by these thieves who call and prey upon their goodwill in nature. You know, our generation is, we want to be accommodating, we want to be friendly, but at the same time, today, you have to verify. You have to verify everything. A couple of things we're going to talk about is the easiest way these thieves get access to you is by your phone or your email or your front door. Okay? Summer's coming on. You're going to have everything from magazine solicitors that will tell you every story in the world about why you should buy their product, and a lot of them don't want to take no for an answer, do they? And the reality of that is once your door's open and their foot is in your door, if they want in your house, then they're there. After 10 minutes of you saying, I'm really not interested, but thank you so much for coming by my front door, coming by my house, one of them, maybe a young lady of the two, said, well, ma'am, it's so hot out here today. Can I just use your bathroom just for a minute? And this has happened right in this county, and it'll happen again this summer, no doubt, that absolutely, come in, go ahead and use my restroom. And while you're still talking to her friend, she comes back out a few minutes later and they thank you and off they go. It's not till maybe a week later that you go in and you realize that your wedding ring's not there anymore. Or some of your jewelry. You know, ladies, that jewelry box that's on your nightstand or on your table in your bedroom. And the stark reality of that is it's about a 99% chance you will never see that again. So again, we just have to try to keep our wits about us and stay as calm and collected as we can. There's nothing wrong with being friendly, but at the same time, you have to be safeguarded, in your demeanor. Official mail delivery, and this looks very official. It's got official at the top, it's embossed, says you're a provincial payment winner, and it's not worth the paper it's written on. But what these people want, and this is by mail, is they want you to call a phone number and you have to deposit money in order to be the big winner. And again, this is not worth the paper it's written on. It's a complete scam. Comes in a nice envelope. Again, looks official enough. Completely made up. You'll receive envelopes in the mail, unusual mail packages, we like to call them. Priority Mail Express, U.S. Postal Service, and this is an actual, real U.S. Postal Service envelope that the thieves will go and pick these up and will mail hundreds of these out a week. UPS, legal. You think, oh, well, legal express envelope, this must be legal, real. But unfortunately, all of these checks that come in the mail, and they are good-looking checks, and they've got all kinds of colors, and they're embossed, and all kinds of fancy signatures, and they're not worth the paper they're written on. None of it. Completely fictitious. But what they want you to do, they want you to come in and take this to your bank and deposit it. And if you'll deposit it because they're unable to, for whatever reason they've made up, then you will be able to keep $3, $4, $5, $6, maybe even $1,000. And I know everybody's sitting here thinking, I would never do that. But yet people do it every day because the allure of something for nothing is just too strong. And the stark reality of that is if you put your signature on the back of that check and you deposit it in your bank, you have guaranteed that check, a worthless piece of paper. So another scam that we are dealing with weekly is the jury duty scam. And we're getting calls from many, many Oldham County residents. And that's where I'm going to play a couple that's just in the last couple weeks, if you'll listen just for a minute.
Yes, ma'am. Yes, I go to Lord in reference to Mrs. Karen Ragging. Mrs. Ragging, my name is Fiscal. I'm the Oldham County Sheriff's Office. I wanted you to contact me back as soon as possible. Promising this message. You can show by contacting me back here at the Sheriff's Office on our anonymous phone line. The number for that is 502-453-4630. Again, it's 502-453-4630. Again, it's Deputy Phil Fiscal. I'm the Oldham County Sheriff's Office. It is imperative that you go ahead and contact me back today. This is an ongoing civil matter that doesn't require attention. Let's go ahead and contact me back and go over to stand these as soon as, all right?
This is Sergeant Gerald Giles in the Oldham County Sheriff's Office. I'm looking to make initial contact with Elizabeth Robertson. Please give me a call back at 502-237-3481. That's 502-237-3481. Thank you.
It's imperative that you call me back immediately. This is very important. You could potentially be jailed if you don't call us back. These thieves who make these phone calls are schooled at how to make you feel pressured. They work to make you feel as pressured and as uncomfortable in the shortest amount of time so that you don't have time to think. Has anyone ever received a phone call like that or a scam call that they believe is a scam? Yes. Mm-hmm. So what's the best course? Again, you feel pressured, you don't want to hang up, but that's exactly what you need to do. I have it on good authority that the FBI just like us. Normally, we don't call first before we come over. So, in all seriousness, hang up. Hang the phone up and call Oldham County Dispatch or call the Sheriff's Office. But under no circumstances, hear me on this, will law enforcement, us, the FBI, the IRS, your bank will never call you and threaten you with your account being frozen, arrest, unless you pay right then and there, or unless you provide your personal information. It's not real. So what you need to do is hang the phone up, and if, call the Sheriff's Office or Oldham County Dispatch if it'll put your mind at ease, but do not, and tell your friends this, do not ever pay money over the phone or on the internet. So I'm going to go ahead and introduce Rick Davidson. Rick's going to wrap this up for us today with the Sheriff's Office. But again, if it sounds too good to be true, then what?
It is.
Then it is. Remember that.
Okay.
Yes, sir.
Quick
Yes.
question.
Yes, sir.
I understand the post office has been hit here recently. Crestwood, they've gone into the outside mailboxes and taken mail out of the boxes and get checks out of there or whatever. How's that being addressed? I think they removed those post office boxes.
So that it's actually, yes, the Crestwood Post Office is going to take the big blue box out because it was literally pried open about 3 weeks ago and the mail was stolen. And, we've been saying this for years, is in today's world, and I still write checks too, you cannot put those in your mailbox or put those in a blue box. You need to take those inside the post office and hand them over the counter. There's people that ride around all day long and do nothing but pull up the mailboxes and look for checks. Yes, sir.
Hey, does the sheriff's office, do they take Amazon gift cards to pay off your warrants or anything?
No, we,
What about a Target?
no Target, no Amazon, we're no Green Dot cards, no. And again, it's not the way the judicial system works in this county or anywhere in this nation. We will never, ever call you on the phone and ask for money with a prepaid card. So, thank you, Mark. Okay, Rick?
I'm so glad that you're here, as you've come to listen, to learn, to get educated. My time with you is going to be brief. But in your bag, you received a note from the Sheriff's Office. It's a small brochure. It just reveals to you the things that we offer. The Community Services Unit desires to come into the community. We will meet with any group, anywhere, any size, anytime. We speak with church groups. We talk to civic clubs. We talk to brotherhood, sisterhood groups, neighborhood watch groups. We'll meet with any group that will listen to what we want for you. And it's for your protection, it's for your service. And so you can see on there that when you scam prevention, one of the things that's been real to me in the recent history is cybercrime. One of the things that I want to make sure we all understand, the folks that fall victim to this has nothing to do with how smart or how not smart, how old or how not old. It has nothing to do with those things. And so I have a friend who is a professor at a university. He's renowned. He speaks all over the world. But he's at his computer, and a window pops up and says, "This is Microsoft Windows, where you are under severe threat of being hacked and all of your information taken. If you'll follow these instructions, we can help you." And he followed every instruction given to him. He gave them full access to his computer. They launched onto his laptop and went to his banking sites and went to his Social Security site. They went to his retirement site. And then they said, "Well, do you file taxes online?" "Well, yes." "Well, where are they?" "Oh, they're right here." And then he opened up where he had filed all of his taxes. Complete access. It took us a week to lock everything down. He'd give me a call. This was a Friday afternoon. He gave me a call. By the next Friday, we had everything locked down. We had all access stopped. We called all of the credit agencies with no ability. We set up passwords so that nobody could set up a line of credit on all of his things. It was a lot of work, but we were successful. And so we go through some of those things in the training time, what to do to not be. But if you are, then here's what to do. And so we try to do that for you as a community. I'm going to close with just 5 things to note, and these are some of the things that we would give you in a class setting. 5 things that should bring a red flag to your circumstance. If someone contacts you, it doesn't matter what it's about, business, sales, gift, if they contact you, that's a red flag. You didn't reach out, you didn't try to get access, they called you. Second, if they dangle bait, if somebody's dangling bait in front of you, if somebody's offering you something, right? There's nothing free in this world, right? They want your personal information. Anybody who asks for personal information over the phone or through email or through any access, there's a problem with that. You should never give it up. You have to pay them first. Anything that requires you to pay them first, that's a red flag. It's a likely scam. You have to wire money or gift card. So those 5 things are a warning flag to anyone that's in touch with you over anything. They call you, they dangle bait, they want your personal information, you have to pay them first, you have to wire or send them a gift card or money. Any of those 5 things, this is an immediate issue. Stop the communication, turn off the computer, wherever that's at. And so we are glad to be here, glad that you're here, and our desire is to come where you are. We offer many opportunities for you to live safe, live free, and be at peace. So thank you for our time here at our gathering.
All right. Thank you so much, Sheriff's Office. We really appreciate that. Next up, we have our Office of Senior Medicare Patrol, and we have Sarah Castro-Daughtery and Michelle List.
Good morning, everyone. I'm Michelle List. I'm the director of the Senior Medicare Patrol Program for Kentucky. How many of you have heard about Senior Medicare Patrol? No. We're a national program. There's 54 SMPs. We're funded through HHS, the Department of Health and Human Services, through the Administration for Community Living. And we use a grassroots approach to deal with healthcare fraud. Our mission is to work with Medicare beneficiaries, family members, and caregivers to educate you about healthcare fraud, and we do that through events like this. We do it through working one-on-one with beneficiaries when they have questions. And we feel like prevention is the best way. You just heard from the person, from the Attorney General's office. Once you get involved in the scam, it's costly and time-consuming, so we like to do the prevention. And I'm going to talk a little bit this morning about what's new with Medicare. You have to know a little bit about Medicare basics to understand healthcare fraud, and my colleague Sarah is going to talk about healthcare fraud. With Medicare, every year there's changes. Most of the time there's going to be changes associated with costs, and sometimes there's even lower costs, which is always a good thing. And for 2023, there are some changes with the cost to Medicare. As many of you know, there's 4 parts to Medicare. There's Part A, and I'm just going to cover like an overview, the basics. I'm not going to get real complicated with Medicare because you can get it's complex. With Part A, that is your hospital insurance. It is free if you or a spouse has worked 10 years. If you have worked less than 10 years, you can pay, and it depends on the number of years your spouse has worked, so you can purchase that. Some of the costs associated with Part A is each year you have a deductible. For 2023, that deductible is $1,600 for a benefit period. And after that, after you go in the hospital and you pay the $1,600, you do not have any cost sharing for the first 60 days of that hospitalization when you're inpatient. Part B is your medical insurance, and that will cover labs, that will cover doctor's visits, and Part B has a premium, and that's what you pay each month for that medical insurance. That amount is going to vary. For 2023, $164.90 is the standard premium. That cost can go up for individuals who make above $97,000 a year, and that premium amount will be lower if you qualify for programs. If you have limited income and resources and qualify for programs, you can pay less than that amount. But $164.90 is the standard premium. And then after the premium, there's also a deductible. That amount for 2023 is $226 per year. That is your portion before Medicare starts paying with the cost sharing. After you pay that deductible, what typically happens is Medicare will pay about 80%, and you're responsible, or if you have a supplement, that will pay the additional 20%. There's also Part C. Part C is a Medicare Advantage plan. You have probably seen them advertised on television quite a bit. Those costs are going to vary depending on the plan that you choose. A Medicare Advantage plan will replace original Medicare Part A and Part B, like I just talked about, with a private insurance company. They will provide those services for you. They will typically have a Part D prescription drug plan, and they will have additional benefits that Medicare doesn't offer. You also need to read the fine print just to make sure that it is what you want to have, like dental coverage. It may not cover routine dental, or it may not cover crowns. You have to make sure you read that. And it will also have different costs associated with that. And those costs, like I said, will vary. You also have to be cautious because you want to make sure your doctors and specialists accept that Medicare Advantage plan. Then there's also Part D, which is the prescription drug coverage. Those costs are going to vary depending on what plan you enroll in. But just, some overall costs. The national average for the Part D premium for 2023 is about $33, $32.74. You may pay a little bit more, you may pay a little bit less. That's just the average to give you some idea of the cost. And then the maximum deductible for 2023 is $505 per year. Not all plans have a deductible, and that deductible amount may be a little bit lower. So that's just kind of a little bit of an overview on some of the costs that change every year with Medicare. I'm also going to talk about some new things that have happened in 2023. With the Inflation Reduction Act, that has helped with some of the costs. With Part D, the prescription drug coverage, covered vaccines, including the shingles vaccines, are at no cost to you now. So that will save you money. Another part with Part D, the prescription drugs, is that covered insulin co-payments are limited to $35. So that is a little bit of a decrease, and that can save you some cost. And then Part B, as in boy, covered insulin co-payments, those are now limited to $35, and that is starting in July of this year. The other two items started in January. I also want to talk about enrollment periods with Medicare, because they can be a little bit confusing. There's a number of different enrollment periods. The one that people know about best is the 7 months surrounding your 65th birthday. It will be 3 months before your birth month, and the 3 months after. Those dates have changed. So, and I'll give you an example because it can be a little bit confusing. So beginning in this year, 2023, coverage begins the first day of the following month for when you enroll. So if your birthday is in April, if you enroll in January, February, or March, your coverage will begin in April, your birth month. If you enroll in April, your coverage will begin in May. If you enroll in May, it will be June. June, it will be July, and July, it will be August. So that's a little bit different. It was taking more time for you to start your coverage prior to this year, and that's a good thing. Also, many people think that when they turn 65, they have to enroll in Medicare, and you don't. If you are working or a spouse is working and you are covered by that insurance, sometimes it's best not to enroll in Medicare. It is good to enroll in Part A because you're not paying the premium for that, but you don't have to enroll in Part B or Part D if you have insurance coverage through your employer, and you will have a special enrollment period when you retire. It's also a little bit confusing too because you can be penalized with Part B and Part D if you don't enroll at the proper point in time. There's also a general enrollment period, and that runs every year from January 1st until March 31st. And in the past, your coverage would start on July 1st. But with the change that Medicare has made, starting this year, your coverage will begin the first day of the following month after you enroll. So it's a sooner time period, which is a good thing. They also have some special enrollment periods. Those are for people who lose Medicaid, who live in an area where there's been a disaster or an emergency, if a person's released from incarceration, if a mistake is made because your employer has given you incorrect information, and also sometimes if an insurance agent has given you incorrect information, if you contact the Centers for Medicare and Medicaid Services, they can have a special enrollment period for you too. And then if there's other unusual circumstances, and those will be done on a case-by-case basis. What we hear a lot about from beneficiaries, they will call our toll-free number, and they will tell us about Medicare has called them, and there's a new gold card, there's a new chip card, there's a new laminated plastic Medicare card, and if you remember a couple years ago when they took the Social Security number off the Medicare card, that was a long process. We had talked to Medicare about, you need to take the Social Security number off the Medicare cards for years, and they had talked about doing it. And it was a really big endeavor. It took years. They had a plan where they were going to do certain states at a certain time, and it was a very costly endeavor too. So they're not going to change cards again. So make sure you don't fall prey to that scam, because that's probably the number one scam that we hear about from beneficiaries. And there's always a little bit of a slant with the scam artists who call and do that too. And, beneficiaries say, I can't believe I fell for that scam. I knew better. But, as you've heard this morning, it's the scam artists, that's their full-time job. They have an answer to everything. They make it sound very professional. They will sometimes put you on hold and say, here, talk to my supervisor, and transfer you to another number. So they're very savvy, and they play on your emotions and your fear a lot of times. I think that's all I have for what's new with Medicare, and I'll turn it over to Sarah.
Hello, everyone. Thank you for having me. Excuse me. Okay, so today I'm going to be talking about fraud, specifically within Medicare. I'm going to assume that most of you, if not all of you, are receiving Medicare in some form or a Medicare Advantage plan. So this is a really important thing to be aware of, and we know how complex and confusing Medicare can be. And as Michelle was going through, there's lots of different parts and lots of different details. And the first thing to note is that it's important to try to educate yourself to understand the coverage that you're receiving. Because if you don't understand it, you may not be able to notice when something is not right or when you are losing money for whatever reason. So, as Michelle said, we talk in the community about preventing Medicare fraud, but we also talk about preventing Medicare abuse and errors. I'm going to talk about all three because they oftentimes look like each other and can often be confused. So I want to give you guys an understanding of what all three of these things are and how you can kind of be able to identify maybe a red flag here or there. So we know that fraud is when someone is taking someone's personal information for financial gain or whatever it may be. So when it comes to that, as Michelle said, the most common complaint that we receive is these phone calls from people claiming to be from Medicare. Again, Medicare is almost never going to call you. The rare occasion they will call you is if you have reached out to them first, they're working on something for you and need to get back to you, but it's like 99% of the time. If someone says they're from Medicare, you can immediately hang up. If you hang up on a Medicare representative, they will understand. You can hang up, Google the real number, and then call them and say, hey, did you guys call me? And they can confirm that for you. But most of the time, it will be a scam. They can come up with a lot of different reasons why they need your Medicare number, but unfortunately, that Medicare number is about all that they need, that they can figure out the rest to be able to bill you for treatments or services that you didn't receive. A lot of times, people who call, they may seem legitimate because they already have personal information about you. They may say that they have your street address or whatever it may be, and it makes them appear legitimate. Like many have said already, this is their full-time job, so they're really good, and unfortunately in this day and age, you can find a lot of personal information about people on the internet. If you Google somebody's name, you can find out where they live, when they were born. So we cannot trust that just because somebody already has some information on you, that doesn't mean they are who they say they are. So, scammers with Medicare fraud are very common, but unfortunately it's not just those phone scams of people that are committing Medicare fraud. Unfortunately, most doctors and medical professionals are good and trustworthy, but there's going to be bad guys here and there in every field. So Medicare fraud does happen with medical professionals, and that is a lot of what we educate about. So anybody, any doctor or any professional who's working in the billing department or whatever has, access to personal information. So unfortunately, if there's someone in there, a bad seed, this is something that could potentially happen. I don't want to freak you guys out or scare you. It doesn't happen super often, but it does happen, and it's something that happens in Kentucky. And I wanted to give you some examples of the things we see the most when it comes to actual fraud from medical professionals. This is all within the last 6 months. There was a doctor in Owensboro who was receiving kickbacks from a medical lab for billing his patients for genetic testing. And I don't know whether or not these people ever received the genetic testing, but I know that it was not necessary. So he was just billing his patients for this thing so that he could get paid money for it. And this was a legitimate doctor. So like I said, unfortunately, these things do happen. There was, in Paintsville, Kentucky, there was an addiction center that was billing patients for services they didn't receive, or billing for different doctors that weren't even in the office at the time. And then finally, Greenup County, Kentucky, there's a personal care owner who was convincing her older adult patients to allow her access to their bank accounts to deposit their retirement checks. This one hurts extra. This is extra evil. I don't know how somebody does this, but so that basically she was building trust with her patients so that she could have access to their money and use it for herself. So, like I said, I don't want to scare you. It doesn't happen very often, but we have to be very careful, who we put our trust in. And I'm going to explain, there are ways for us to be able to detect when something weird is going on. Okay. So, I'm going to back up to where I said there's fraud, abuse, and errors. I've kind of described what may happen with Medicare fraud. So, I wish I had a slide with this, but let's say we've got a line, a big spectrum, and over here is fraud. This is like evil person who's stealing information to make money. Over here on the other side, for something that's quite innocent, are errors, okay? So, nobody's perfect, when we've got a full-time job, sometimes we're not feeling it that day, and sometimes somebody who's keying in the medical notes might key in the wrong thing. So that's just an innocent error. It's important for us to talk about because it may cause Medicare to lose money or you to lose money because you're being billed for something that isn't accurate to what happened. So overall, with the phone calls we get of people thinking, oh my gosh, is something fraudulent happening with my Medicare? More often than not, it is an innocent error where somebody has typed in the wrong thing or was billed twice for something that they only received once. It is innocent and can be resolved really easily, but we want to make sure that you guys can catch that so you don't lose money. So that is what an error is. When you go towards the middle, which is kind of this weird gray area, that's Medicare abuse. It's a little hard to explain, but in general, the intention often with Medicare abuse is not to steal money from innocent people. It's this gray area of kind of like bending the rules or not having the most ethical practices that are a little questionable, but it's not clear out just trying to steal money for people. Is this going out? Hello? Okay, so what Medicare abuse looks like is, for example, if, I think an example we've seen before is someone goes to the doctor and spends only a really quick, short, pretty routine visit with their doctor, very short, not many diagnoses or treatments are happening, and then they go to their billing statement and see, oh, I was billed for a level 4 appointment. And in the medical billing world, there's level 1, which is not much time was spent or not many medical decisions were made, and it goes to level 5. So a level 4 is a pretty long appointment. You might be prescribed medication, whatever it is. So that doctor who billed the level 4 instead of a level 1 may not have been saying, oh, I'm going to steal this person's money, but they may just haven't been, using good practices. So I've kind of covered all the different, Medicare billing issues that may happen. Now, how do we detect this? How do we keep it from happening? Okay, number 1 in prevention for any of this stuff is, as everyone has said, protect your personal information. Your Medicare number is like your Social Security number, like your debit card number. That needs to be protected at all times. Do not give it out on the phone, ever. And in terms of detecting, most of the time when we're helping people with fraudulent issues, you guys are kind of like our frontline people who are detecting it. And if there's anything that you take away from what I'm saying today, it is read your billing statements, okay? If you have original Medicare, Part A and Part B, you will receive a Medicare summary notice in the mail, or you can receive it electronically. If you have a Medicare Advantage plan with a private health insurance company, you will receive an explanation of benefits, okay? It is so important to read these. I know I am guilty of not reading my billing statements, and I know Listen, I'm younger. I had to learn the hard way. But I know now when I did it before. It is important to read those very detailed. Because if something's fraudulent, if there's errors, if there's abuse, this is where you're going to catch it. Because there's going to be something on that billing statement that isn't accurate and doesn't align with what actually happened at your doctor's appointment. Now, we could give a whole other presentation on Medicare summary notices on how to read them, because they can be very confusing. There are many pages for, the first like the first like 3 or 4 pages are, pretty unnecessary. The important stuff is on like page 4 or 5, I'm not sure. But they can be very confusing to read. But basically what you're looking for is the date, the name of the doctor, where you went, what services did you receive, and making sure that aligns with what actually happened. Now, I don't know about you guys, but it is difficult to remember all of those things, especially if you're seeing lots of doctors. And that is why we have a resource, if I can get it out, called the Personal Health Care Tracker. This is something that SMP has created. I know it's small, but if you come and grab one from us, you will also get a wallet-sized magnifying glass, which will make it easier, hopefully, to fill out. So what we encourage everyone to do is to take this with you to your doctor's appointments so that you can track, when did I go to the doctor, what did I receive, what was I diagnosed with, so that when you receive your billing statement, you have your handy-dandy little tracker that will tell you everything that you received so you can confirm whether or not everything is accurate, okay? We encourage people to give us a call. Our phone number, we have a toll-free phone number. We cover all of Kentucky, so anybody in Kentucky can give us a call. If there's something that doesn't look right or is confusing in your Medicare summary notice, we take a big variety of phone call type questions. A lot of times over the phone we might just help somebody understand their billing statement, or help them be able to identify, this isn't fraud, it's an error. And if it's an error, that's super quick. All you have to do is call your doctor's office or call the billing department to get that resolved for you. So you can call us about a lot of different reasons. If you ever find out that your Medicare number has been compromised, whether, as Michelle was saying, the people who call to try to get your Medicare number are very good. And they're crossing their fingers, hoping that they're calling somebody who's having a bad day, who's not feeling on top of it, who's like falling asleep so their wits aren't about them, or somebody who's lonely and wants to talk to someone. They're just really hoping they're just calling the right person who's not going to be at their best, And when people feel heightened or strong emotions, their ability to make logical decisions is diminished. And that's not just, certain people. That's everybody. We're all like that when we're feeling, when we're having a rough day. So it happens. The thing to tell you, though, is if it happens and you give out your number and you're thinking, oh, man, I shouldn't have done that. I see that now. You can give us a call. But I also want to let you know that if your number has been compromised, you can call 1-800-MEDICARE and request a new Medicare number and card, okay? They may not offer it to you. You have to ask for it. Something that we've learned. But if you ask for it, they will give you a new one. And also keep in mind that just because your Medicare number was taken doesn't necessarily mean that you're going to be a victim of fraud. Sometimes nothing happens. Sometimes things do happen. The important part, like I said, is to read your billing statement, so then you can catch it if something happens, and reach out to us, and we'll do our best to refer you to whoever you may need to be referred to. In terms of reporting, we've mentioned that, others have mentioned this. You can report to Office of the Attorney General. You can report to the Federal Trade Commission. They have a really easy way to report on their website. And then you can report to us, and we can try to give you some resources that might be helpful to you. Any questions? Yes?
We recently had a major healthcare system with Norton Healthcare, Norton Hospital being hacked. And they have offices even out here in LaGrange. My doctor's one of them. And all I heard on TV was, well, if you paid a bill with your debit card, you might want to change your debit card number. Are you expecting any fallout from that with Medicare and or anything else? Because I haven't heard much about what to do now. If they're hacked, all I know is that it's hard to get a prescription from my doctor. I have to hand carry it now.
Yeah.
Because the system's still a little wonky, so.
I know about the breach. I've heard about it, and you talked about that on Tuesday? Yeah. As far as CMS, we meet with them on a monthly basis, and they don't always share a lot of that type of information, but I would say it would be more from, what Norton shares with you, and then just, some of the good common sense resources, like, receiving your annual credit report, doing a credit freeze, just looking at your bank statements, your credit card statements, and things like that. And LaDonna has some good information too.
Do I need to worry about my Medicare number?
No, I don't think I would worry about your Medicare number. Just, make sure you read your statements. And then if you feel a little bit better about getting a new number, you can call 1-800-MEDICARE or call me and I can kind of talk you through what to say.
Thank you.
There was another, there are actually two that are kind of similar. There was another data breach that ended up impacting, I think, like 6 million people. It was a third-party vendor that transfers medical information between providers and insurance carriers. That's a little bit different one than the one you're describing. With the other one, if you were affected, you would have received a letter. Some people, their social security number may have been compromised. If you were one of those people, the letters that have gone out, I've seen one because a family member was affected, it will give you 2 years of free credit monitoring that would normally cost quite a bit, actually, so take advantage of it. But the only other thing I can really add is that if your social was breached, and I don't know that it was in the Louisville-Norton, I don't know if it's just they've had a glitch or if something was being held ransom.
There's a Russia ransomware.
More of a ransomware, so maybe somebody had locked their accounts, and unless you pay, we won't unlock them. That doesn't necessarily mean they've stolen your information. So I don't really know, but you'll find out that the one thing you could do was just mentioned. You can always check your annual credit report for free, and guess what? Through December 31st of this year, because of COVID, you can actually get a free credit report once a week. Normally it's once a year is free, but you can get it once a week through December 31st. It does not hurt your credit rating for you to check your own. So you can always do that and make sure nobody's out there using your social. It's a good thing to do anytime.
Excuse me.
Yeah, I've got some questions. Okay, yes.
The company that you're talking about, was it Nations?
The third-party vendor was something else, begins with a T.
But I mean, was Nations?
It may have been.
I received a letter in May, and then I received something.
That's when it came out.
A couple of days ago saying about getting
the free credit monitoring.
Get the free credit monitoring.
Yeah, you should take advantage of it because
it did say there was a breach and it could be, they could have all your information, medical information, and your social, blah, 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 you know.
Mm-hmm. Yeah. Yes, another question.
I had a CT scan recently, and they did not, North, and they did not collect the money, the part that I paid. And I had something else done, and they did not collect the part that I paid. And I guess that's what they're trying to do. If they said they would bill me later.
Yeah, they probably wanted, their system may have been down where it was compromised, and so they couldn't take payments. They'll find you.
That was,
yeah.
made me feel better.
Absolutely.
Because I knew it was compromised. compromise.
Absolutely makes you feel better that at least, yes, and we have
One
one
more
more.
question.
Can you tell us what website we can go to get that one, one?
The annual credit,
Yeah.
annual credit report, where's Mark? Annualcreditreport.com.
.org.com.
.com. Annualcreditreport.com. I'm not saying it wrong, am I? You're gonna double check me?
I'm gonna check.
It's good, we're gonna double check. I'm pretty sure it's .com, but we will make sure, and after the lunch, we'll make an announcement to just double check. I'm gonna make sure that I didn't say it wrong. And, that's a great way to take advantage and just see if anything's, because you can also, there might not be anything stolen. There could just be an error that you need to correct on your credit report. Okay, I'll turn it back over and we'll let you know for sure.
All right, guys, thank you all. We're gonna take a brief break for lunch. We have boxed lunches and drinks at the back table. On the left-hand side, Kevin, left-hand side is turkey, and the right-hand side is ham, okay? If you want ice, we've got ice in cups back there. After everybody's settled with their lunch, we're gonna go ahead and have Kentucky Elder Law start their presentation. So you may wanna shift around so you can see either one of the screens. So while we're eating, they'll be presenting on some really great information.
Judge, thank you for having us, and Kara for coordinating this. Really appreciate being involved in this event. I'm John Dotson. I'm one of the attorneys at Kentucky Elder Law. As you might pick up from the name, Elder Law, we help seniors and folks that love seniors. So we try to make sure our seniors stay safe, and I really have enjoyed the program so far. So thank our presenters that are on the panel with us today. I thought it's been a great thing to hear about. We do have a number of our seniors, our clients, who have fallen prey to scams. So it's a very sad situation, and we appreciate our community partners that get out and educate the public to things to be careful of. So as an elder law firm and an elder law attorney, we're typically looking at estate planning documents, governmental benefits, and meeting care needs. So with me this morning, or this afternoon now, is Jen Bloom, one of our social workers. We have 2 full-time social workers on our staff. They're members of our firm. We practice law a little bit differently than certainly any other law firms, but even more than most elder law firms. We actually are not only dealing with money and estate planning, but we're helping folks access the care that they need. So thanks to Jen for being with me today, and for all she does for the families that we serve as an elder law firm. So am I doing down or next or
Arrow.
arrow? Arrow up?
Okay, to the side. More space bar to work.
All right.
We're making it.
There we go.
Okay,
We've
perfect.
got space bar.
Okay.
So elder law is a little bit different than estate planning. So there are a number of very good estate planning law firms out there, lawyers. Estate planning lawyers are typically concerned about taxes and about probate. We typically are not concerned about estate taxes because those don't kick in until about $11.5 million for a person or $23 million for a married couple. So if you're getting close to that $23 million mark, it's probably time to start spending a little bit. So not on scams, though. We're dealing with estate planning. We're dealing with veterans pension benefits for veterans or spouses of veterans. We're dealing with Medicaid, and I'm going to talk a few minutes about Medicaid today. One of the things that I try to educate people on is the foundational documents, your estate planning documents as an estate planner are very different than they are for an elder law attorney. So we need different things than they have in their documents. So the legal documents. In these, I give this lecture frequently. So all of us over the age of 18 need to have these documents in place. An 18-year-old typically doesn't need so much a will, but they may need a healthcare surrogate or a living will, a power of attorney. I had a lady call me, and her daughter was going to study overseas. I had helped her mom, and so her daughter was going to study abroad, and she had her own bank account, and the mom wanted to be able to make sure her finances were managed, so we did a power of attorney for her so that she would be able to take care of those things. So all this part of the discussion really is for all of us. It's for all of us. So the four basic documents are a detailed, durable power of attorney who can deal with financial matters for you, an up-to-date will who gets your things if you were to pass away, a living will directive, your end-of-life decisions, and a healthcare surrogate designation. That's who can speak for you in regard to medical care, medical decisions, if you are unable to speak for yourself. So I often start with the durable power of attorney, the financial document. Durable means it stays in effect even if you later become incapacitated or incompetent. And you want one that goes into effect immediately, okay? So, I often have people that will come in and they have either downloaded something from a website, or they have been to see another lawyer, or their friend just said, here's what you need. And they have what is known as a springing power of attorney. A springing power of attorney is signed, you have signed it, but in the document itself it says, upon the determination that I am incapacitated, and sometimes it says, if my treating physician says it, or if two physicians say it, that's when this document becomes effective. So, if you imagine you're in an incapacitated situation, you've had a stroke, you've had a fall, you've had a car accident, you have dementia, you have Alzheimer's, you have Parkinson's-related dementia, something has happened, and you're not able to take care of your financial affairs. And then your son or your daughter or your niece or your nephew is running around trying to get doctor's notes that say you're incapacitated. So I love our physicians. I appreciate them very much. It's hard enough to get in to get your medical care. But imagine you're trying to get in to see a doctor to get them to write a letter that says you're incapacitated. So I won't do those for people. I've had people sit down and go, I don't really want it to be effective right now. And I'm like, well, you sure don't want it to be effective and have to wait until you're in a crisis, and then your child, your niece, your nephew, whoever is running all over town trying to get doctor's notes. So I won't do those. Our recommendation is you name one person at a time. Occasionally I do name two to act. The reason being, you probably have one checkbook you're operating out of. If daughter lives in Indianapolis and son is here, it doesn't mean son has to do it, but it can be complicated if both of them have to show up to take care of anything. So our recommendation is you name one person, but also name an alternate. And for any of you that either know us or know me, so most of the members of my firm are in the practice of elder law because of family situations. So, about naming an alternate. So I'll sit down with people and they'll say, well, I've got a power of attorney. And I name my daughter. And so, but you might be 92 years old and your daughter's 71. So if you don't have a backup, what happens if something happens to your daughter? Okay? So my granddad had 2 children, my mom and my uncle. He outlived both of them. So it happens. It happens. So his cognition was pretty good. He lived to be 95 years old, so was very blessed in that. But he could sign a new power of attorney after both of his kids had passed. But the problem is, what if you're not able? What if you've named one person, and that person either becomes incapacitated themselves, or passes away, and you're not competent to sign a new one? So I advocate very much with my clients, let's name a primary, let's name a backup, and sometimes we put a third one on there just in case. Because I'll occasionally have someone not married, no children, wants to name her sister. And her sister's 68 and very healthy, and that's wonderful. But what happens, why don't we name niece, nephew, or someone younger as just, they don't have any authority now, but they're a backup if something were to happen. So that is very important. We record the power of attorney where you own real estate. It's not legally required to be done as a matter of law, but the question becomes, for many of our clients, what if they lost the original? Okay, so we like to record that document in the county where you own real estate. That way it's on file, it's on record. If you have lost the original, it's safe. Okay, and also, if Sue Jones moves into the new Trilogy building out here in Oldham County and needs to sell her home, and she's named her daughter as power of attorney, if that is on file in the county court clerk's office, your daughter is able to sell the house for you, take care of that for you. So that's part of why we do that. That probably got some things in here that we don't need to talk about too much, but in recent years, the Kentucky legislature made some changes in the Power of Attorney Act. It used to be that you had to say it was durable in the document. Now it is presumed to be durable, which means it stays in effect even if you later become incapacitated. There are some banks that are easier to deal with than others. I'm not a banker, never have been a banker, but there are some that are easier to deal with than others. Occasionally there are banks that will just say, well, I'm not accepting this document. And the legislature saw fit to set up a procedure by which you can enforce the use of that power of attorney. So, and occasionally banks will get punished for not accepting a valid power of attorney. So that's the financial document, durable power of attorney. You often hear people talk about POA. I'm POA. So power of attorney, the ability to act on behalf of someone else in regard to financial matters. Healthcare surrogate. We call it a healthcare surrogate. You could call it a healthcare power of attorney. You could call it a medical power of attorney. I am a very strong advocate of naming one person at a time on this document. Here's the reason. You're in surgery, and I see these documents all the time, often prepared by other lawyers, and I'm not critical of other lawyers. Other lawyers are probably our biggest referral source. They know what we do and they get people to us. But sometimes a lawyer has prepared a healthcare surrogate. A client has 3 children and they name all 3 of them. Okay, well, you're in surgery, doctor comes out and says, we found this, that, and the other that we didn't expect to find. I think we should remove it, or I think we should do this, or I think we should do that. You've named 3 kids as your healthcare surrogate and they don't agree. So I really, really, really advocate to people, name one. It doesn't mean if you've got 3 kids or 8 kids, it doesn't mean they can't talk to each other. It just means you've got a spokesperson who's going to see to your decisions. We like to see a HIPAA authorization in that document. One of the old forms that we see out there doesn't have that in there because it's pre-existing HIPAA. So we'd like to see that in there. And again, as I mentioned in the financial document, we really want to see a backup or a successor or a second in line on this document. Third document I typically talk about is the Living Will Directive, our end-of-life decisions. A living will, and I think I may have this in here somewhere, a living will is very different than a DNR. Many of you have heard DNR, do not resuscitate, DNR. That's very different than a living will directive. A DNR would apply, I have a heart attack, hit the floor dead, do I want them to resuscitate me? So, yes, I have 24-year-old twin daughters who still rely just a little bit on Dad, so I think they would want me to be resuscitated. But a person who's 94 years old with end-stage Parkinson's probably would not want to go through that, okay? So having a DNR, do not resuscitate. We don't prepare those, so as lawyers we don't prepare those, but we do prepare Living Will Directive, and Living Will Directive is basically 3 things. That if you're actively dying, terminal condition with no chance you could survive, you don't want to be stuck on machines like a ventilator, and you do not wish to have a feeding tube stuck in your abdomen. So that's 1 and 2. And the third one is, do you wish to donate tissues or organs, or perhaps your body? They typically go hand in hand. They're on the last one about donation, there is research and education, which is for people who want to sign up to donate their body to perhaps the University of Louisville College of Medicine. The more frequent choice is tissues and organs. Tissues and organs. So Jen and I have a really good friend whose mom had a severe stroke in her 50s and passed away. And they donated her organs. And it was a very difficult situation for our friend, but that gave her some peace that her mom would live on helping other people. So donating tissues and organs to help living people. So that is the Living Will Directive. Your will. Okay, so I could probably talk to you all about wills until Judge ordered supper for us. So, wills. Maybe one of the most important things I say to you about wills. A will covers that which is in your name, and your name only, that does not have a beneficiary designation on it. Okay? Your name and your name only that does not have a beneficiary designation. So I had tell you just a quick story. Had 2 children came in to see me. Mom had passed away. And we have a very large, our firm been doing elder law for 21 years, and so we've written a lot of wills. So we have a huge probate practice and estate practice opening estates for families. Had 2 children came to see me. Mom had passed away. And said, we need help opening probate. I said, be glad to talk to you. I sat down with them and asked them what Mom had. Well, Mom had sold her home and moved in with the 3rd child, who was not in the office. Yeah. All right. So yeah, the people know this outcome is going to be interesting. So I said, well, what did Mom have? And it was a son and a daughter, and the son said, well, she had 3 bank accounts. And I said, well, before you hire me to do anything, why don't you go find out if she put a beneficiary on the bank account, like a POD, pay on death, or did she add anybody on to the bank account as joint owner? 2 or 3 days later, the son called me back. He said, well, told me what he found out. I said, well, good news and bad news. The good news is you don't need me. Bad news is when Mom added your brother as a joint owner on her bank accounts, that means her will doesn't apply to it anymore. And here's the thing. Please don't hear me be, I'm not critical of bankers. Mom went into the bank with her son, the other son, and said, I want to add my son to my bank accounts. Well, could the bank do it? Well, yeah. It's her bank account. She could have added me to the bank account. You can add anybody you want to your bank account. But I guarantee you, Mom did not know the legal ramifications of doing that. Mom had 3 kids. Her will says I leave my estate to my 3 kids equally, 3 equal shares. I guarantee you she did not know when she added her one son as a joint owner on the bank accounts that meant her will no longer applied to those bank accounts. So, the outcome is one joint owner died, one joint owner remains living. The money all belongs to the other joint owner. Now, remember, Mom had moved in with that son. So, you hear the stories, well, Mom told me, or I took care of Mom, or I did it, and it actually wouldn't matter if he had a story. He could have literally just said, tough luck. She put me on there, it's my money. Because legally that's true. Legally that is true. So, I know being an elder law attorney, I'm saying consult an elder law attorney, but you know the insurance commercial out there that says we know a few things because we've seen a few things. This is all we do. This is all we do, oftentimes 6 days a week. So it's something that we try to educate people on, that just because you can do something doesn't mean it's a good idea to do something. So to make a valid will, I may tell one more story about wills. To make a valid will, you have to have 2 witnesses see you and each other sign it. A notary is recommended because if it's notarized, it will be self-proving, so no one has to testify in court about you signing your will. So I had a lady come see me, said her brother had died, needed to probate his will. She handed it to me. I'm flipping through it. And I get to the back where he had signed it, and the 2 witnesses had signed it. And I said, ma'am, is this your signature as a witness? And she says, yes. She said, you know, my brother hated lawyers. And I said, well, you know, I mean, yeah, okay. He didn't want to use lawyers, so he called me and said, Sue, bring your husband and come to my house. And she did. She got there and he said, sit down. You and Bill are going to witness my will. And she did what she was asked. She's not a lawyer, so she did what she was asked. All right. So, there's a law in Kentucky, and it's probably in most states, to prevent abuse and taking advantage of people. If you witness a will that names you as a beneficiary in the will, you can only receive what you would otherwise receive if the person who died did not have a will. Okay, because it's to prevent me from coming to your house and saying, you're going to leave your estate to me and I'm the witness of it. Okay? It makes sense. It makes sense. Okay? Now, it was a sister, man's sister. He was not married, he was divorced. But he had 2 children. He had 2 children. He had not spoken to his children in over 25 years, completely estranged. He didn't leave a dime to his children in the will.
Well, like 3 cents.
So he just excluded them completely, okay? But under intestacy law, if he died without a will, his children would get it all. His sister would get nothing. So the law is, again, because he had children, since she witnessed the will, she could get nothing. He had a $400,000 estate. Now he saved himself $200, $300, $400, whatever it would be to go get a will. He cost his sister $400,000. So you know the old saying, you don't know what you don't know. So he was a bright guy, and you know, and if people don't like lawyers, that's so I'm not mad at him about it, but he cost his sister $400,000. Okay. Gosh, I told you I could talk all day long about that. Yes, ma'am. Question.
In the state of Kentucky,
Yes, ma'am.
is it a law that if you adopt children, you have to leave them something?
No, ma'am. No, ma'am. No, ma'am. You do not have to leave adopted. You don't have to leave birth children. You do not have to leave.
What I'm saying is,
Yeah.
my husband, because he had to do a second marriage.
Okay.
He passed away. He thought that he had to leave money to his children.
Yeah.
Something about the law. I said, I don't think so. I mean, he did, and I didn't want their money. But, you know, I got my own. I don't need yours.
Yeah.
But the fact that he was, that I have to do it, I said, go for it.
Yeah. Yeah. Well, so yeah, not necessarily. Not to make fun of someone who's passed away, but that was probably not the best legal analysis. No, you do not have to leave two children. Here's one thing, and I'm going to just touch on a few minutes in a second, Medicaid. So I have people come into my office several times a year who said, my mom is in a nursing home and was on Medicaid. And now they tell me she's no longer eligible. And I say, did your dad just die? And they say, well, how'd you know that? And I said, I see it. I see it. So many of you may know, if you've ever dealt with the Medicaid system, the rules are very different, married versus single. So if a married person goes into a skilled nursing facility and applies for Medicaid, and the other spouse lives in a home, has a home, a residence, that residence is exempt. Because Medicaid doesn't want to leave the community spouse, it's called, without a place to live. Okay. But they didn't see an elder law attorney to explain what happens if the community spouse dies while the other spouse is in the nursing home. Okay? So if any of you own a home, and you could look at your deed, if you're a married person, 99 chances out of 100, it says joint with right of survivorship. Joint with right of survivorship, which is typically the way you want it. Okay? You were 48 years old, you bought a home. If your husband died, you wanted it to go to you. If you died, you wanted your husband to get it. Okay? What happens if husband's in a nursing home on Medicaid and you don't think, I better see an elder law attorney, and I don't change the deed to my house, and then the community spouse dies, okay? Nursing home spouse is still living. Nursing home spouse all of a sudden owns a home, and what? Not on Medicaid anymore, okay? All right. So, bye-bye house. But very seriously, and again, you know, we want to help people. We are a private law firm, but we want to help people. You don't change the deed, and you change the will of a community spouse so that that spouse, that's that slide right there that you've got in your handout, you don't leave to your husband or you don't leave to your wife, okay? So if your husband's in a nursing home on Medicaid and you own a house, what we would do is redo your will to set it up one of two ways. Set it up in a trust for him if you died and he's still alive, or leave it directly to children or other people, so that he no longer would own a home if you died. So, and please understand, again, I'm not being critical of our Medicaid caseworkers. Okay, they're overworked, they work very hard. Their job is not to tell you what you should do. Their job is to process applications for governmental benefits. Okay, so you don't go to the Medicaid office seeking advice on how do I protect my money and property. That's what people come to see us about. Guardianship.
Question.
Yes, ma'am. Question.
The look back.
The look back. Very good question.
How long is it, and would they not look at that will change?
Very good. That's an excellent question. There is a 5-year look back on transfers for Medicaid, okay? But there is no look back on transfers between spouses. There is no prohibition between a wife and a husband deeding the house from joint to the other. That doesn't trigger any of the Medicaid issues.
To the other one, but what about to the trust or to a third party?
Good question. Her question was, okay, well, what about a transfer to a trust or to a third party? Okay, and we'll be over here, Jen and I will be over here. I do love questions, but I'm going to try to get through a little bit of Medicaid, but let me say this. Adding a child to a deed is a gift. And if it's done within 5 years of needing Medicaid, it will cause a problem unless that child falls into an exemption, which is a very narrow exemption. So you can't plan on that working. So adding a child to a deed can cause problems. What I was describing is if I've got a married couple and the one of the other spouse, not in the nursing home, is still at home. Okay? So, proactively speaking, what if I've got a 72-year-old man, 70-year-old wife, and their health is decent? We might put the farm or the house in a trust, in an irrevocable trust, and there's information, and again, maybe I should have led with this. You've been handed out what I'm talking about. So you've got that. You can take it home with you. We use an irrevocable trust for what we call asset protection. And what that does, kind of in light of her question, it starts the 5-year clock ticking on Medicaid. So if I put a house, if I put an investment account, if I put a farm in an irrevocable trust, and I make it 5 years from the time I've done that, it's safe. Medicaid can't come after it. It doesn't count against you for governmental benefits. So we use that tool a lot, especially in pre-planning when I've got somebody that's not in a crisis. We kind of people tend toward one of two poles in our practice. On one end of the spectrum is people who are planning ahead. I don't need any care right now. I just want to be able to protect my assets if I do. Then I've got somebody who's at Baptist Health. They fell and broke a hip. They're not going to be able to go back home. They will need long-term care, and that's the crisis. And we help both sets of people. Oftentimes the outcome is a little better the earlier we start. So Medicaid in Kentucky pays for skilled nursing. They pay some for in-home, but it doesn't work very well for most people because of the requirements, the financial requirements to qualify, the impoverishment rules, and then the limitation on how much care they will pay for. But typically, the Medicaid that we're dealing with, and of course we had some great Medicare, and I know you probably know the difference. Medicare is your insurance Love that presentation. Medicaid is a governmental program that is a needs-based benefit to help, does a lot of things, but in the context of elder law, it helps pay for long-term care. And it is, you have to qualify financially for that. Medicaid calls what you have a resource. So you have income, Social Security, pension, IRA, required minimum distribution, that's income. What you have in the bank, in your investment account, in property, those are resources. So we have to qualify from a resource standpoint for Medicaid benefits to cover the cost of long-term care. The rules, as I mentioned earlier, are vastly different if you're single versus married. If we have a married couple, oftentimes I can protect just about everything they have, okay? So it really, the rules for a married person are very beneficial because just the main concept is Medicaid doesn't want to impoverish the other spouse. Because a nursing home may cost $8,000, $9,000, $10,000, $11,000 a month. And so not a whole lot of us could write that check every month for a year, 2 years, 3 years. So that's kind of why our practice is busy. Is the cost of care has gone up so much that not a lot of people can write that check. Now it's a wonderful thing when you can. It's fantastic when you can afford that, but for most of us we can't. Medicaid basically says if you're married, community spouse, which is a spouse who's not in the nursing home, can keep up to $148,620. Now, that's of countable resources. One thing I would tell you about Kentucky, that is, we're an outlier state, and this is a beneficial situation where we're an outlier. In Kentucky, retirement accounts are exempt. So IRAs, 401ks, 403bs, rollovers, Roths, those are exempt in Kentucky. They don't have to be spent down. So it is good. It is a good thing to have money in retirement accounts. I will tell you that I have had people told the wrong thing, and they would come into me later than I wish they had and said, well, we've already cashed out our IRA. Somebody said you had to spend it. But that's in Kentucky, if you're in a facility in Kentucky. In Indiana, and I have 2 lawyers that practice in Kentucky and Indiana. We do quite a bit in just the river counties there. So in Indiana, the institutionalized spouse, their retirement account counts, but the community spouses don't. So it's kind of a half and half over there. We get the benefit of all of that. So it helps people save money. You don't have to spend that down. Goodness, Judge, I do want to wrap up and we will stay around, as I mentioned. And the other thing is you've got the handout that has these slides in here. Let me do these. I'm going to answer this question. But I get these questions frequently. I just want to mention these, highlight these. Paying your family or friend to take care of you. Okay? So one of the worst things, like if I go to the bank and pull out $500 in cash, is there any way to trace where that went? There's no way to trace it. If Medicaid can't trace it, they want to penalize it. Okay? So if you are going to the bank, if your loved one needs care and you've got Sue Jones from church who's coming in and sitting with your husband, and you go to the bank twice a week, pull out $300 or $400, but then your husband needs to go to a nursing facility and you can't afford to write that $8,000 or $9,000 or $10,000 check, and you want to apply for Medicaid, well, this cash is going to cause a problem. Medicaid's not going to pay. Also, even if you write a check to Sue Jones, They won't pay unless Sue Jones has a signed caregiver agreement that complies with the Medicaid regulations in place. We do a lot of those because there are a number of people that want to do that. One thing that you don't have to do, if you hire a home instead, if you hire a comfort care, you hire elder care for families or Cornerstone or any number of our care providers and non-medical in-home care companies, you don't have to have one of those. Now, I know they're more expensive per hour than Sue from church, but there are benefits to hiring an agency. Not only what I just mentioned, but that they carry workers' compensation on their people and they're bonded. So I won't say that I'm adamantly against getting your friends and neighbors and paying them, but there are complications to that. Selling a home for less than PVA value is called a gift. So years ago, people just used to go in, they were getting ready to go to the nursing home, they'd deed their house to their daughter for $1, and then go into the nursing home, and they would tell Medicaid they hadn't given anything away. They hadn't. They sold it for $1. So Medicaid, to combat that, said that if you sell, actually it's any property, but mostly it deals with real estate. If you sell a piece of property for less than fair market value, you've made a gift to the purchaser. Okay? So, if you deed your house, and Medicaid accepts the PVA value as fair market, okay? Most houses now are worth more than the PVA, so that can be actually beneficial. But if you've lived in a house since 1958, and it hadn't been updated at all, and the houses around it have sold, therefore the PVA value has creeped up, your house might not be worth the PVA value on it. So that's an issue we have to deal with sometime. Already mentioned adding the child's name to a deed and giving a child the 16, it's actually, I'm speaking to a group of accountants tomorrow, it's actually $17,000 now. The IRS says you can give $17,000 a year to someone without having to report it to the IRS. Well, that's true, but the IRS is a completely different agency than Medicaid. So Medicaid doesn't let you give your money away. Yes, sir?
Does that count property of equal value?
That's 16 or 17?
Yeah.
You can. I'm not a real estate lawyer, but I know that sometimes people are giving partial interests in real estate, yeah, as a way to do that. Yes. Yes, ma'am. I know you.
Yeah, I just, to clarify, when you said you're talking about investment accounts,
Yes.
you don't have to spend them down.
Retirement.
Retirement accounts, you
Yep.
don't have to spend them down.
That's correct.
Are you or are you not talking about RMDs?
The question relates to RMDs. So once I think it's 72 now, it was for a long time was 70 and a half, was the age at which you had to start taking required minimum distributions. That's an IRS rule because they're wanting some tax money. So you have to take out your RMDs because the IRS is going to wallop you if you don't. But with huge penalties. But so the RMD comes out. If you're on Medicaid, the RMD comes out. We typically have people do it monthly. So, yeah.
Okay, but is that what you were talking about when you said you don't have to spend those down?
No.
That's what
Here,
I'm asking.
okay. So you got a $200,000 retirement account. Let's say the RMD is $5,000 a year. You don't have to spend down to $195.
Okay.
But you would spend the $5.
Okay, all right.
Yeah. That's a good question.
That counts up your $148,000.
The corpus of it does not. That's
the withdrawal does.
Well, that's actually income. It's going to be a little bit different calculation, but yeah. It would count if you saved it. If you spent it, it wouldn't. Yeah. Go spend it. I gave some more examples about a little more thorough discussion of those little bullet points. already said this, if the sooner we get started planning, the more we can preserve. We do a free consultation with families. We're a little different in that. Our first meeting doesn't cost anything because when we sit down with somebody, we don't know if they need help or not. So sometimes, and I love having Jen here. We do get a lot of thank you notes from people for what we do. So oftentimes it's related to what Jen and Megan, our social workers, do. But sometimes a lawyer does something right. So we get a thank you note. But occasionally it's from people that didn't hire me. They sat down with me and I said, "You're good. Keep what you've got. Come back if you need help with care." And they'll write a note, and just made them feel good just to know they're in good shape. So we are, all our attorneys are accredited by the Veterans Administration. That's a little bit unusual to have that. And then I get out to speak. Mentioned earlier that y'all talk to church groups and so forth. We do the same thing. Our other social worker and I, Megan, went to church on there in Louisville on Browns Lane a week or so ago to speak to one of their seniors group. So thank you all for your attention. Thank you all, Judge, for putting on it. It's been, to me, it's been really great. And so thank you for being here.
Thank you, John. Thank you very much. Thank all of our presenters here. We're going to wind up here now, and everybody's still at their table, so everybody's welcome to go around and seek answers to your individual questions. Sue Bricken's still here. No, the reason I ask is that we had a door prize drawing on a number generator system. Maybe I can't explain it, but Tara can. But anyway, we got to have a birdhouse that Sue won, but since she's not here, it's going to go to Carol Ralston. Okay. All right, so Carol said. Thank you all very much for coming, and please go around and ask any questions, and we really appreciate you coming today.